Hello and welcome to Crack the Boards. In today's video, we will have a look at USMLE questions related to physiology. Let's have a look at the first question. A 58-year-old woman presents to the emergency department with 50 minutes of chest discomfort and mild dyspnea. A cardiac assessment reveals a small myocardial infarction affecting the septum of the right atrium inferiorly and posteriorly near the ostium of the coronary sinus. Which of the following is most consistent with the location of the infarction? A. Absence of any conduction defects. B. Atrioventricular block. C. Cardiogenic shock. D. Damage to the sinoatrial node. E. Mitral regurgitation. The correct answer is B. Atrioventricular block. This is actually the most likely scenario, and here's why. The AV node, located near the coronary sinus, is responsible for transmitting electrical impulses from the atria to the ventricles. If the infarction affects this area, it could damage the AV node, disrupting the heart's normal conduction pathway. This would most commonly lead to AV block, which means the electrical signals from the atria would be delayed or blocked entirely from reaching the ventricles. Option A is incorrect because when we consider the anatomy of the heart, we know that the AV node, which is crucial for conducting electrical signals from the atria to the ventricles, lies near the coronary sinus. The infarction affecting the septum of the right atrium could disrupt the conduction pathway. Hence, it is unlikely that there would be no conduction defects. Option C is incorrect because cardiogenic shock occurs when the heart is unable to pump blood effectively, leading to severe hypotension and inadequate tissue perfusion. It is typically caused by significant damage to the heart muscle, especially in cases of large myocardial infarctions where there is a substantial loss of myocardial function. The small infarct, which is mentioned in this question, is more likely to affect the AV node, leading to conduction abnormalities rather than severely impairing the heart's ability to pump blood. And option D is incorrect because the sinoatrial node is responsible for setting the heart's rhythm, and it's located at the junction of the superior vena cava and the right atrium. However, the infarction in this case is affecting the septum of the right atrium near the coronary sinus. Therefore, it's unlikely that this infarction would directly damage the SA node as it's in a different part of the heart. And option E is incorrect because mitral regurgitation typically results from damage to the posterior medullary papillary muscle, not the septum of the right atrium. If the papillary muscle were damaged during a myocardial infarction, it could affect the mitral valve and cause regurgitation. However, this is not relevant in this case because the infarction is localized in a different area. Let's have a look at the second question. During a scheduled cesarean section, a healthy 30-year-old woman undergoes the procedure to deliver her baby. During the surgery, approximately 800 ml of blood is lost over the course of 45 minutes due to the incision and delivery process. After the procedure, which of the following physiological variables is most likely to be lowered compared to her condition before the surgery? A. cerebral blood flow, B, heart rate, C, plasma renin concentration, D, splanchnic blood flow, E, systemic vascular resistance. Option D is the correct answer because following blood loss, sympathetic activation triggers vasoconstriction in the splanchnic arteries, reducing blood flow to the intestines. This mechanism prioritizes perfusion to vital organs like the brain and heart. Thus, splanchnic blood flow decreases after blood loss. Let's have a look at why the other options are incorrect. Option A is incorrect as the brain has a remarkable ability to maintain consistent blood flow through a process called autoregulation. Regardless of the moderate blood volume loss from the surgery, cerebral blood flow remains steady to ensure proper brain function. So this is unlikely to decrease after blood loss. Option B is incorrect because you might initially think heart rate would decrease, but the opposite occurs. When blood volume decreases, the baroreceptors in the carotid sinus detect this change. In response, they activate the sympathetic nervous system, increasing heart rate to compensate for the reduced circulating volume. Therefore, heart rate actually increases rather than decreasing. Option C is incorrect because renin plays a key role in maintaining blood pressure and volume. With a decrease in effective circulating volume, the macula densa senses reduced sodium delivery, and beta 1 receptor stimulation further enhances renin secretion. So plasma renin concentration rises, not falls, and that's why this option is incorrect. And option E is incorrect because when the sympathetic nervous system is activated, norepinephrine is released, causing vasoconstriction via alpha 1 adrenergic receptors. This constriction increases systemic vascular resistance to maintain blood pressure despite reduced blood flow. Hence, systemic vascular resistance does not decrease but instead increases. Let's have a look at the third question. A 29-year-old woman, Gravida 2, Para 1, visits the clinic for a follow-up during her pregnancy. During the visit, an ultrasound is performed and the fetal measurements confirm a gestational age of approximately 24 weeks. At this stage of pregnancy, what is the primary source of progesterone in the maternal bloodstream? A. Fetal adrenal cortex, B. Fetal ovary, C. Maternal ovary, D. Placenta. The correct answer is D. Placenta. In the early stages of pregnancy, before 8 to 9 weeks, the maternal ovary plays a crucial role in producing progesterone through the corpus luteum. Now, the corpus luteum is a temporary structure formed in the ovary after ovulation. Following implantation, the corpus luteum continues to secrete progesterone supported by human chorionic gonadotropin, which is produced by the developing placenta. However, the corpus luteum's function is temporary, and by 8 to 9 weeks of gestation, the placenta takes over the role of progesterone production, and the maternal ovary is no longer the primary source. Let's have a look at why the other options are incorrect. Option A is incorrect because the fetal adrenal glands do play a role in pregnancy, primarily by supplying dehydroepiandrosterone to the placenta. This dehydroepiandrosterone acts as a precursor for the production of estrogens. However, the fetal adrenal cortex does not contribute to progesterone production. Placental progesterone synthesis is independent of fetal adrenal input. And option B is incorrect because the fetal gonads, including the fetal ovary, they're not involved in producing progesterone for the mother. They are also not required for the placenta's progesterone production. The fetal's ovary development is primarily geared toward preparing the baby's future reproductive capacity, not contributing to the maternal hormone levels. And option C is incorrect because in the early stages of pregnancy, the maternal ovary plays a critical role. The corpus luteum, sustained by the human chorionic gonadotropin, secretes progesterone to maintain the pregnancy. However, this function is temporary, and after 8 to 9 weeks of gestation, the placenta takes over the progesterone production. This concludes today's set of questions, and thank you for watching.